Hello, my name is Dr. Brian Durie, and on behalf of my co-authors, it is my great pleasure to present the results of this post-hoc analysis of the efficacy and safety in the SWOG S0777 trial, stratified by age. The phase 3 SWOG 077 study compared the effectiveness of VRD to RD alone in patients with newly diagnosed multiple myeloma. Treatment with VRD resulted in superior progression-free survival and overall survival versus RD. Patients in the study included those who were either eligible or ineligible for autologous stem cell transplant. In this poster, we explore possible heterogeneity of the treatment effect based on age. Here, we use age 65 years of age as a proxy for transplant eligibility status. Individual data from the SWOG S0777 study were obtained from the National Cancer Institute. Stratified analysis by age group, less than 65 and 65 years or older, were conducted for randomized patients who met inclusion criteria and had valid informed consent. Progression-free survival, overall survival, and safety were evaluated. Patients were analyzed according to the intent to treat principle. Statistical methods used in analysis of the data are described in the poster, and sensitivity analyses were performed to adjust for potential imbalances across groups. A total of 471 patients with newly diagnosed multiple myeloma were included in the analyses. 269 patients were under age 65, and 202 were 65 years or older. In this table, you can see patient demographics and the baseline clinical characteristics. Within each age subgroup, there are some imbalances between treatment groups and demographic and baseline clinical characteristics, shown as a standard mean difference of more than 0.1. Irrespective of treatment group, older patients tended to have worse performance status and more advanced disease as measured by the International Staging System. Here in this chart, you can see progression-free survival in patients treated with VRD and RD in the two upper graphs and overall survival in the lower graphs. Data from patients less than 65 years are shown on the left, and 65 years and older on the right. Median progression-free survival and overall survival were lower in both treatment arms in older patients. The estimated relative benefit of treatment with VRD versus RD for PFS and OS was smaller for the older age group. A sensitivity analysis to adjust for potential imbalances between treatment groups and age groups were consistently in line with the primary analysis. In both treatment groups, the incidence of grade 3 or higher treatment emergent adverse events and treatment discontinuation due to toxicity were higher for older patients. In conclusion, the estimated relative benefit of VRD versus RD with respect to progression-free survival and overall survival was smaller in magnitude for patients aged 65 years or older, which was used as a proxy for transplant ineligibility, relative to patients aged less than 65, used as a proxy for transplant being deferred in this S077 trial. Grade 3 and above treatment emergent adverse events and treatment discontinuation due to toxicity were higher in both treatment arms in patients aged 65 years and older relative to the younger patients. The present analysis shed light on possible treatment effect heterogeneity based on age at enrollment in the SWOG S0777 trial. Ongoing studies of BRD in transplant-ineligible patients with newly diagnosed multiple myeloma using subcutaneous bortezomib may provide further clarity on the benefit of this treatment regimen in older patients. This analysis was supported by Janssen Global Services, and we're grateful for that. Thank you for your attention.